When you start thinking about automating medication management in your hospital, the big question is, where do we start? Today, we'll be comparing two options in the CUBEX lineup, the Mini and the Tower. They protect your controlled substances, automate compliance, and give you real-time visibility into what's on your shelves. So the question is not which one is better, it's which one is right for your hospital. Both the Mini and the Tower run on Mashura OS, the leading inventory automation software for veterinarians. They digitize your controlled drug logs, keep you ready for a potential DEA inspection, connect to your PIMS, and track every transaction with biometric access. Either way, you start with the same foundation of safety, security, and real-time data. If you are a 1 or 2 doctor hospital focused on automating drug logs, tightening compliance, and improving safety for controlled substances, the Mini is a cost-effective, purpose-built solution, managing your active stock of Schedule II to Schedule V medications at the point of care. The Mini safeguards the drugs you rely on for surgery, sedation, and pain relief, such as ketamine, propofol, fentanyl, and more. Inside, you can mix full and half-height drawers with up to 2 full-height drawers and choose between single-item access cubies or matrix compartments to match your security needs. On average, the Mini manages 28 items depending on their size in a compact footprint that fits almost anywhere. For hospitals that simply want to solve controlled drug security, compliance, and manual drug logs, the Mini is the ideal way to get started. For hospitals that want inventory to fuel production and profit, not just satisfy compliance, the Tower is the clear choice. The Tower automates the management of controlled substances, treatment injectables, drugs of concern, and high-value pharmacy items. Drawers can be programmed with different permission levels, so active and backstock inventory is managed separately, restocking protocols are protected, and you no longer need a separate backstock inventory log. With roughly twice the height and more drawers, the Tower manages over 120 items on average, more than 3 times the capacity of the Mini. That is massive capacity in a small footprint. The Tower also introduces charge capture, tying every dispensed item to a patient invoice. On average, hospitals miss about $25,000 a year in revenue per doctor from missed charges. The Tower helps you recapture that revenue. By automating cycle counts, restocking, and ordering with minimum and maximum par levels based on real usage, it also frees up manual inventory time worth thousands of dollars in production capacity. Compared to the Mini, the Tower delivers significantly more value. If you want to maximize workflow efficiency, unlock savings, and drive stronger revenue performance, the Tower is calling your name. Both the Mini and the Tower are built on the same idea. When your inventory takes care of itself, your team is free to take better care of patients. The Mini is designed for hospitals that want a simple, best-in-class way to automate controlled drug logs and stay compliant. For hospitals looking for more value from their inventory system, the Tower delivers that same compliance and automated logging, plus time savings, workflow efficiency, and stronger revenue and profit impact. Whichever you choose, you are choosing safer medications, stronger controls, and more freedom for your team. 2 smart cabinets, 1 smarter way to run your hospital.